A week after healthcare workers begun getting vaccinated against the coronavirus, many are wondering what's next. While states are rolling out plans, the timing is still up in the air. Ashar Qureshi talked to some experts on what the priority list should look like.
For the last 9 months, the checkout lines have not slowed.
We took one day off. We took off Easter Sunday. We closed the store and said, everybody's got to take a break. Thank you.
Essential workers like grocery store staff have worked tirelessly during the pandemic to keep the shelves stocked and Americans fed, in many cases taking great risk themselves.
Perfect.
All right, thank you.
John Whipperforth, who, despite taking every precaution, came down with the virus.
Took a little time off and a little more cautious afterwards. But I was cautious before. That was the real scary part.
In fact, researchers at Harvard University recently found that supermarket workers who had direct contact with customers were about 5 times more likely to contract COVID-19 than their colleagues who didn't interact with customers. It's one reason experts like Lori Post, director of the Buehler Center for Health Policy and an emergency medicine professor at Northwestern University, says essential workers following healthcare workers should be a priority.
They can't work remotely. They must show up to work. They need to be vaccinated. They're high up on the priority list.
Right now, across the country, frontline healthcare workers and long-term care facilities are at the top of the list. But Post says these groups, factory workers, correctional officers, inmates, and disproportionately affected black and brown communities, should be prioritized ahead of healthy adults. An exact timeline for when the general public could get vaccinated is tough to pin down. Additional emergency approvals could accelerate a potential summer rollout for healthy people. But even when the vaccine is readily available and a distribution plan is in place, it could be months more before restrictions are eased.
Best case scenario next summer, middle summer, end of the summer, that we're going to be able to have enough vaccines.
And for those who have worked hard to keep the economy going and Americans eating, they are still ready and waiting in line.
Most of us are looking forward to being vaccinated and being safe and being part of that group that's going to make everybody safe.
Reporting from Chicago, I'm Ashar Qureshi.